As the body ages, chest muscles lose their strength, and the smaller airways of the respiratory system, called the bronchioles, lose their elasticity and can collapse. These age-related changes decrease the ability of an older adult to inhale oxygen, resulting in fatigue and increased difficulty completing activities of daily living. Although some respiratory function can be maintained or restored through exercise, the aging respiratory system leaves older adults more susceptible to acute respiratory illnesses, such as influenza, pneumonia, and COVID-19. Because the respiratory system is necessary for life, if a nursing assistant notices any issues with breathing or a blocked airway, these concerns should be reported immediately to the nurse. Because the cardiovascular system transports oxygenated blood, some symptoms of respiratory distress are similar to cardiovascular complications, such as cyanosis, fatigue, dizziness, and shortness of breath. Exercising and avoiding smoking are vital for maintaining or improving respiratory function. This slide and the following 5 slides outline the common chronic conditions of the respiratory system and related interventions. Bronchitis. Definition: acute or chronic inflammation of the bronchioles, i.e., small airways. Symptoms to report: cough that produces mucus, fatigue, shortness of breath, and chest discomfort. Specific interventions: encourage fluids to thin the mucus segment activities of daily living and position the patient for breathing comfort. Emphysema. Definition: a chronic condition in which alveoli hyperinflate, causing reduced air exchange and resulting in a lower amount of oxygenated blood in circulation. Symptoms to report: shortness of breath that becomes increasingly more difficult as the disease progresses. Specific interventions: encourage healthy weight and activity as tolerated, segment activities of daily living, and encourage the use of supplemental oxygen if it is prescribed. Chronic obstructive pulmonary disease, COPD. Definition: chronic inflammation of the lungs, often caused by smoking, chronic bronchitis, asthma, or emphysema. Symptoms to report: shortness of breath, labored breathing, dizziness, disorientation, and cyanosis. Specific interventions: encourage healthy weight, activity as tolerated, and smoking cessation. Lung cancer. Definition: cancer in the lungs. Symptoms to report: chronic cough, coughing up blood, shortness of breath, and chest pain. Specific interventions: encourage smoking cessation, healthy weight and activity as tolerated, segment activities of daily living, and position the patient for breathing comfort. Bacterial pneumonia. Definition: bacterial infection of the lungs. Symptoms to report: fever, chills, shortness of breath, productive cough with green, yellow, or bloody mucus, sharp chest pain, fatigue, and confusion or disorientation. Specific interventions: encourage healthy diet, activity as tolerated, rest, and taking antibiotics as prescribed.